everyone, my name is Lindsey Reeves, and I am really grateful to be here today, even though it's virtual, to speak to you all about fatigue management strategies for living with chronic pain. Let me go ahead and share my screen and presentation with all of you. So like I said, my name is Lindsey Reeves, and I'm an occupational therapist. So I work with people who have chronic pain, chronic migraines, and I work on helping them learn how to cope with and adapt to living with a chronic pain condition. And one of the areas that a lot of people that I work with, particularly people with CRPS and other chronic pain conditions, report and complain about are these symptoms of fatigue, overwhelming fatigue in their day that really impacts their ability to participate in their everyday activities. So again, today we're going to go through some strategies for that. And I do just want to take a moment to acknowledge my colleagues, Dr. Rebecca Cunningham and Dr. Malia Seiko, who collaborated with me on creating this presentation. So just a little bit of background about fatigue. It's defined as a subjective lack of physical, cognitive, or emotional energy that is perceived by the individual to interfere with usual and desired activities. And because with CRPS and this ongoing pain signaling that our body is experiencing with a chronic pain condition, that's really taxing on our nervous system. Our brain is constantly receiving this threatening and dangerous signal, and it's focusing on that. And so it can take energy away from other parts of our body and can result in this sense of fatigue. It's also important to know that while feeling tired and feeling fatigued can outwardly look the same, they are very different experiences. So with fatigue, it's not just the need for rest or sleep or a nap. We might still feel fatigued even after a good night of rest. So just being aware that there can be a difference there. As far as different fatigue types, it's important to differentiate between primary versus secondary sources of fatigue. So primary fatigue is the type of fatigue that's directly related to the disease process itself. So like I mentioned with chronic pain, it's really exhausting to be living in that constant state of pain. And so this can increase over the course of the day, or during times when pain is heightened, fatigue may also be higher. Now, secondary factors of fatigue are kind of all of the compounding factors in our daily habits and our routines that can make or exacerbate fatigue. So that could be our mood, symptoms like depression, anxiety. It could be sleep challenges that we're experiencing, medication side effects. A lot of times patients will report fear avoidance behaviors or isolation. And so they might just not be moving as much. And that deconditioning can also contribute to a sense of fatigue. Being exposed to chronic stressors, other comorbid conditions that could be contributing to the fatigue, mobility limitations, cognitive deficits, low blood sugar levels, even the quality of our food, all of those things can really impact our energy levels throughout the day. Another thing to think about with fatigue is there's also acute fatigue and chronic fatigue. So acute fatigue is something that may only just occur for a short period of time. And this may be as a result to a specific circumstance or a stressful event. Whereas chronic fatigue is going to be something that's more ongoing. It's lasting for more than 6 months. And it emerges with long-term issues. So like maybe that chronic exposure to a stressor, you may be experiencing that chronic fatigue. And then lastly, also note that there's a difference between central fatigue and peripheral fatigue. So central fatigue is going to be this full body exhausted feeling. It will usually have components not only of like physical fatigue, but also cognitive and emotional sources of fatigue as well. And resting may not alleviate those symptoms. Peripheral fatigue, on the other hand, may be depletion, fatiguing, or progressive weakening with prolonged use. And so this can be remediated by like stopping the activity, taking a rest break, things like that. And so also just thinking about the overall presentation of fatigue. I think a lot of times when we think about that, we tend to only consider our physical exhaustion, but there are also sources of cognitive fatigue, emotional fatigue, and all of those factors contribute to the overall sense of fatigue. So we really want to evaluate all of those components. And essentially what we want to talk about today are strategies that are going to help to prevent this overexertion cycle. A lot of times with chronic pain, what I hear is that on days when pain is better managed or I'm feeling really good, then I want to do everything I can on that day. But what that leads to is then symptom exacerbation and then having to recover and pay for it the next day, or maybe even for the next week or two. So it's like this prolonged recovery time because I overdid it in that one experience. And so I want to help give you strategies that are going to help you find a middle ground so that we're not overdoing it and we're not crashing and recovering. We want to be able to maintain activity engagement in a safe and an effective way. So we'll talk about both primary fatigue interventions, ones that directly address the fatigue source itself, and then also talking about those secondary interventions that target more of those kind of compounding factors as well. As far as categories of fatigue management interventions, we're going to go through pacing strategies, which are strategies that help us get through the activities in a safe and effective way. We're going to talk about energy conservation strategies, so things that we can do to modify the task itself so that it's less energy demanding from us. And then some strategies for energy optimization. How can I plan my activities and evaluate my daily activities in a way that matches the fluctuations in my energy levels? So we'll go through all of those things. Starting with activity pacing, one thing to consider is this idea of activity shifting, which is finding a balance between low, moderate, and high demanding activities, or categorizing activities in a way that can be useful. Scheduling frequent breaks so that you're never reaching your threshold for activity and exacerbating symptoms of pain. Moving at a slower pace, just doing things more mindfully and more slowly. Strategies for simplifying activities, and then pacing strategies to limit recognition and compliance. So on a micro level, we can think about activity pacing within a specific activity itself. So when I perform a task like sorting my laundry, a lot of times we jump into that task and we go from start to finish without ever really checking in and evaluating how we're feeling. With micro level activity pacing, what I want to encourage you guys to think about is through each step of a task, taking a moment to check in and evaluate those energy levels. So in this example here, the person's going to start by doing step number 1, which is sorting the laundry. And then we want to check in, how did that make me feel? Not only on my fatigue levels, but maybe also my pain levels. And if there haven't been any changes, then going to the next step of carrying that laundry downstairs to prepare it to go into the washing machine. But once I get downstairs again, before just going to the next step, let me take a moment to check in. And at this point, I've realized my fatigue has increased, maybe my pain has increased a little bit. And so instead of just pushing through, this is the point at which we want to just take a moment to take a break, have an opportunity to kind of return back to baseline where energy levels are normalized again, pain levels may go back down, and then proceeding to the next step. And then you'll see through the rest of this example that it's at each step of the task that it's really about that self-analysis and self-check-in and implementing a relaxation strategy or something to manage energy levels in that moment instead of pushing through to the next step. The alternative to that is thinking about pacing more on a macro level. So the micro level is thinking about within an activity itself, how can I pace myself? Then on the macro level, we want to think about over the course of the day or over the course of a week, how do we manage our energy levels? And so when I'm planning my weekly activities, you'll see in this example that yeah, I do have some priorities to get done during the day, but I know that food shopping and doing meal preparation is really exhausting. So I'm also going to prioritize some time for rest. And you'll see that there's rest scheduled on each day of the week. An alternative to this might be, if I've done a few too many tasks on Sunday, then maybe on Monday, rest is the priority with maybe one lower energy demanding activity. And then this example here is one for looking at a specific day itself, where again, there's this balance of doing the activities that you need to do, but planning for rest breaks in advance. So this is a good example since you guys are all participating in a conference, but attending sessions and scheduling some time for rest breaks in between before you go to your next session. So those are examples of macro level pacing. Going to that idea of activity shifting, this is when we want to find a balance between the types of activities that we're doing throughout the day and throughout the week. So here are some examples of how you could categorize that. It could be defining your priorities as things that are either restorative or depleting, defining them as physical, cognitive, or emotional tasks, maybe deciding if the things that you're doing that day are high, moderate, or low energy demanding, or categorizing them as what type of task they are. Is it a productive task? Is it a restorative task? Is it a self-care task? And essentially, if we were to color coordinate all of our activities in our schedule, we'd really want to find a balance. If you did that and you saw that, all of today's activities were high energy demanding tasks, that would be the cue to you to say, okay, that's probably a red flag. That could make me feel really fatigued. And let me try to create more of a balance in my day. Let me sprinkle in some low demanding tasks, or let me move this high demanding task to another day. So it's just an opportunity to shift those activities around so that there is more of that balance. Activity simplification is really all about breaking down the task into all of its steps and figuring out how can I make it simpler? How can I reduce the overall energy demands? So there's a few examples on here, but just by taking a moment to break down this task of doing my taxes into the 4 different steps that I have to do, that might make it feel extremely less overwhelming. And you can break it down to say, I can do each one of these steps on 4 different days or over the course of 4 days instead of doing it all in one sitting. You could also think about, I'm planning a party and these are all of the things I have to do. Can I delegate some of these tasks? Can I, again, pace myself by scheduling them out over the course of multiple days? Maybe there's ways to simplify it by catering the food or purchasing pre-chopped vegetables or things like that. So by really breaking it down into the steps, it gives us more opportunity to evaluate how we can simplify the task itself. And then limit recognition. So really recognizing when you've reached your limit within a certain task. I like this diagram because it visually helps us understand that if I start a task and as I'm going through it, I get to a certain point where I recognize, I'm starting to feel fatigued and I could push myself to get to the end of this task. But the problem with pushing through is now that I've reached the end of the activity itself, my fatigue level is higher, which essentially means it's going to take me twice as long to recover compared to if I just stopped that activity at the moment that I noticed the onset of symptoms. It's going to require less time to recover, and you're essentially exposing your nervous system to less risk by stopping the task earlier. So this is another really important one, kind of goes back to that micro level pacing of checking in within the task and recognizing when you've reached your limit. Moving on to some of the energy conservation strategies specifically. So we'll touch on activity modification, changing our body positioning, finding ways to engage in restorative tasks. Everything we do takes energy, so we want to make sure that we're also finding ways to boost our energy levels throughout the day. And then strategies like delegating and modifying our environment, because our environment plays a really big role on how much energy is required from a task as well. Sorry, my slides are jumping all over the place. Energy optimization. So this strategy is really about finding ways to schedule activities that aligns with your energy patterns throughout the day. So I know personally, I tend to have more energy in the morning, right when I wake up. Other people tend to feel really fatigued in the morning, and it takes a little bit of time to get their energy levels up for the day. And so I'm going to schedule my tasks one way. That person might schedule their tasks a different way. But again, it's about being intentional about that so that you're not planning to do a high energy demanding task when your energy levels are really, really low. And so one of the well-known theories in the chronic pain world is the spoon theory. So I'll touch on that for a moment. It's a theory that was created by a woman who was sitting at a table with her girlfriends, and they really weren't understanding why on some days their friend could show up and participate in activities with them, but on other days she had to cancel her plans. And so she grabbed the spoons on the table at the restaurant that they were sitting at, and she said, you know, each day I wake up with a certain number of spoons, a certain amount of energy available to me. And I have to make a decision about how I'm going to use that energy as effectively as possible. So if I only wake up with 10 spoons and going to lunch with all of you beautiful people requires 5 of my spoons, and just getting dressed to go to lunch requires 1 of those spoons, I'm only left with 4 more spoons for the day. And if I know that I also have a healthcare appointment, then that's all I can do in a day. But maybe I have other tasks on my to-do list that are a priority. And so I might have to make decisions so that I'm not depleting all of my energy resources and having to borrow more spoons, because that's when we're going to really experience the fatigue. So the spoon theory also provides some examples of, you know, more simple tasks or one-step tasks are going to require fewer spoons or lower amounts of energy, where things that maybe require you to go in the community or maybe other people are involved, there's more social interaction, those are going to be higher energy demanding or more spoon tasks. And I think this is has been a helpful resource for a lot of people because it helps to communicate with loved ones, with family members. You know, I'm out of spoons for the day, and that's maybe something that they can relate to in a different way than just saying I'm feeling fatigued. So it's helpful as a communication tool as well, I think. Another kind of energy optimization theory that I like to use is this idea of a water pitcher. And so thinking about at the start of the day, maybe after a good night's rest, my water pitcher might be full of water. But then as I go throughout my day and I play with my kids or grandkids, and then I garden, and then I engage in self-care, I take a shower, that's really emptied out my pitcher. And so I might get to the point of, you know, playing with my grandkids, doing my self-care and going grocery shopping, and my water pitcher might be empty, which means I can't do that housework. And that's okay. It's then the awareness to say, okay, that was maybe the lowest priority task for the day. And so I'm going to reschedule it to another day. So there's the spoon theory, there's this water pitcher analogy. Another one that I really like is kind of thinking about our energy either as a battery, like how charged is your battery today or right now? I think that's something a lot of people can relate to now that we are all on electronics very often. Or thinking about, you know, the analogy of how much money is in your bank account. Maybe some days your bank account is full and you have a lot more energy to do the activities you need to do, and other days you don't have as much money in there. So I think finding a way, and whatever analogy really makes sense to you, and using that as a tool and an opportunity to communicate with the people in your life, so that they can better understand where you are in your energy levels, and how you're making decisions to prioritize certain tasks. One other thing that, sorry, I'm going to go back to this slide for a moment. As far as energy optimization, is also just thinking about, like this picture is showing, the use of adaptive equipment. Adaptive equipment can be any tool that just makes a task easier to accomplish. So it could be using an electric can opener, or an ergonomic knife that protects our joints a little better, so that it's not requiring as much effort and strain. It could be using a walker or a cane or an ambulation device to help offload the effort of walking. So there's a lot of good adaptive equipment pieces, things like shower bars, shower benches. Though all of those are examples of things that can help conserve energy within the task itself. And even just taking a moment to set up your environment so that it is promoting neutral posture and allowing you to feel comfortable during the task is another great way to save energy as well. Okay, so now we'll jump to some of those secondary fatigue management strategies, thinking about all of the kind of compounding factors that can make fatigue feel even worse. Obviously, I put sleep as the first one because sleep is going to have a direct effect on our energy levels. And if our sleep routines are not well managed and we have sleep disruption, it can really interfere with how we feel the next day. So if there are sleep challenges that you're experiencing, there are a lot of great evidence-based interventions for sleep. So things like talking about sleep hygiene, which is really focusing on the routines around sleep. Are we winding down? Are we going to bed at the same time and waking up at the same time each day? How does our environment impact our sleep? Is our body on this circadian rhythm? So there's a lot of great sleep hygiene strategies. Those are just a few of them. Also thinking about stimulus control. When we don't sleep well, if we get in the habit of doing certain things in the middle of the night, like turning on the TV or getting on our phone, our brain starts to associate those activities with being in bed and being awake. And so we can develop this conditioned arousal response where that's actually keeping us in a wakeful state and feeding into this sleep disruption cycle. We can also look at things like self-regulation training. So training you in relaxation techniques, things that can help activate the relaxation response in the body so that it's preparing our body for sleep. And there is cognitive behavioral therapy that is specific for insomnia treatment. That is another great tool. Side note that it is contraindicated for patients with epilepsy. And then if waking up in the middle of the night to go to the bathroom is a barrier to your sleep quality, there's also things like bladder management strategies. So all of these things can help improve your sleep routine, which should also help with the fatigue management. Another area to think about is physical activity. A lot of times with chronic pain, understandably so, there's this fear of activity engagement, and again, some maybe fear avoidance behaviors, which results in people maybe being sedentary, and that can lead to deconditioning and muscle atrophy. And so staying physically active is a really important part of expending enough energy during the day to help support our sleep routines so that we feel restored and well rested in the morning. So with physical activity, we of course want to find activities that are safe and motivating for you as the individual. There isn't kind of one size fits all physical activity routine. It's really about finding what works well for you. And then thinking about gradually increasing participation. We don't want you to kind of jump into something you haven't been doing for a very long period of time, but safely and gradually getting back into something that is enjoyable for you. And physical activity is also a great way of restoring energy levels. We get that endorphin rush, and we can help to boost our energy levels during the day. I know sometimes it's that dreadful feeling of, oh, I don't want to do anything physically active, but I'd say 99% of the time afterwards, people tend to actually feel more energized. Then thinking about the impact of stress on energy levels. So similar to pain, if our body is in a constant state of stress, again, that's really fatiguing, and probably maybe a little more emotional fatiguing than physically fatiguing. And so in the primary effect of being exposed to a stressor is it can exacerbate symptoms of fatigue and pain. But again, there's these compounding effects, like I know if I am stressed, I don't sleep well. So now I'm stressed, and that's emotionally exhausting, and I'm not getting a good night's sleep. And so all of that can make those symptoms of fatigue worse. And so we want to work on, well, how do I manage that stress more effectively so that I am not at risk for this exacerbation of fatigue? And there's a lot of different evidence-based stress management interventions, things like relaxation techniques, so meditations, deep breathing, imagery. There are cognitive-based interventions, so things like positive psychology exercises, adapting our thinking and our reactions to stress, and then health-promoting coping strategies. So exercise is a great way of alleviating stress. Simply being outdoors and being in nature is a great way to alleviate stress. And also just doing things that you enjoy, engaging in leisure and pleasurable activities, whether that's reading or creative pursuits or socializing with friends. Those are all great ways of coping with stress also. So there's a lot of tools that we can turn to if you feel like stress is a primary source that's contributing to the fatigue. We also want to think about eating routines. What we put in our body can affect our energy levels. If we're skipping meals or we're eating low quality meals, that can really bring our energy levels down. So we do want to think about eating at a consistent and regular frequency so that we're regularly fueling our body with the nutrients that it needs to engage in activities. If our blood sugar levels are regulated, it's going to support energy regulation. Eliminating, foods that are maybe triggering or can cause like significant peaks and drops in our blood sugar, like sugar intake, is another way to kind of prevent that crash feeling. And then also just being mindful of liquid intake, staying hydrated with water, and limiting the use or being mindful of the use of caffeine and alcohol, because they can also cause that crash effect. So another thing to kind of evaluate, are the things that I'm putting in my body potentially contributing to the fatigue that I'm experiencing? Medication management is another thing to consider. If we are not taking our medications as prescribed, or maybe the timing of our timing of taking the medication varies from day to day, that can impact our symptoms. But also thinking about like medication side effects, having discussions with your doctors about that, and reviewing, could any of these medications be making my fatigue worse? And things that are going to help with adhering to your medication schedule are going to be like pill boxes and memory aids. That could even be like a timer so that you're taking it consistently throughout the day. Scheduling strategies, where you're storing your medication, so it can be a visual cue for yourself. And then I touched on some of these other ones as well. As far as ergonomics and body mechanics, the way that we perform our activities can also cause fatigue if we're not using neutral positioning. So we do a lot of training around neutral postures in certain activities, whether it's work or driving, childcare tasks, and then just, again, making sure that you're going into the task, taking a moment to make sure that you're in that neutral posture so that it's not as taxing on your muscles and your joints, causing more fatigue. I mentioned this earlier, but adaptive equipment, these are great examples. Kitchen carts, laundry carts, grocery baskets, shower benches. All of these things are just gonna make the task easier to perform with reduced effort. And so that can be a great energy conservation skill. And then also thinking about restorative routines and restorative activities. So we talk so much about the things that deplete our energy. We also want to make sure that we have activities that restore us. So I think rest often gets misconceived as sleep or napping, but it can really be anything that helps to boost your energy and improve your mood. So think about that. Are there things that we could be doing in your day that help to improve your energy levels? With that, I went through a lot of information very quickly. So hopefully some of those tips and strategies resonated with you, but I know it was quick. So if you do have any questions, please feel free to reach out to me. This is my contact information. And if you did want more education and training, we do offer one-on-one sessions with patients. And that's something that usually requires a referral. But again, for more information, you can call our office at that phone number there. So with that, I will hopefully allow you guys to take a break before your next session. And I hope you enjoy the rest of the conference.